HESI A2 Anatomy and Physiology Respiratory System. Introduction to the Respiratory System. Welcome to our HESI A2 Anatomy and Physiology series. In this video, we'll explore the respiratory system, your body's gas exchange network that brings oxygen in and removes carbon dioxide, making cellular metabolism possible. By the end of this video, you will be able to explain the function of the respiratory system, identify the structures of the upper and lower respiratory tracts, describe the mechanics of breathing, inhalation and exhalation, understand gas exchange in the lungs and tissues, discuss the regulation of respiration, recognize common respiratory disorders. Overview of the respiratory system. The respiratory system enables gas exchange, bringing life-sustaining oxygen into the body while removing waste carbon dioxide. Primary functions. Gas exchange: oxygen enters blood, carbon dioxide leaves blood. pH regulation helps maintain acid-base balance by controlling CO2 levels. Voice production: air passing through vocal cords enables speech. Immune defense filters air and traps pathogens in mucus. Temperature and humidity control warms and moistens incoming air. The big picture. Every cell needs oxygen for metabolism. Cellular metabolism produces carbon dioxide waste. Respiratory system provides the interface between air and blood. Works closely with cardiovascular system for gas transport. Upper versus lower respiratory tract. The respiratory system divides into two main regions based on location and function. Upper respiratory tract. Nose and nasal cavity entry point, filters and conditions air. Pharynx, throat, shared pathway for air and food. Larynx, voice box, contains vocal cords, prevents food entry into airway. Lower respiratory tract. Trachea, windpipe, main airway to lungs. Bronchi and bronchioles, branching airways within lungs. Alveoli, microscopic air sacs where gas exchange occurs. Transition point. Lower tract begins below the vocal cords. Upper tract conditions air for lower tract. Infections can affect upper or lower tract differently. The nose and nasal cavity. The nose serves as the primary entry point for air, with specialized structures for air conditioning. External structure. Nares, nostrils, external openings for air entry. Nasal septum divides nasal cavity into right and left sides. Internal features. Nasal conchae, curved bony shelves that increase surface area. Mucous membrane lines nasal cavity, produces mucus. Cilia, microscopic hairs that move mucus and trapped particles. Air conditioning functions. Filtration, hairs and mucus trap dust, pollen, and microorganisms. Warming, blood vessels warm incoming air to body temperature. Humidification, mucus adds moisture to prevent lung tissue drying. Olfaction, smell receptors detect odors. Why nose breathing is better. More efficient air conditioning than mouth breathing. Reduces risk of respiratory infections. Maintains optimal humidity in lungs. The pharynx and larynx. These structures serve as the transition zone between upper and lower respiratory tracts. Pharynx, throat. Shared pathway for respiratory and digestive systems. 3 regions. Nasopharynx, behind nasal cavity. Oropharynx, behind oral cavity. Laryngopharynx, below oropharynx. Contains tonsils and adenoids for immune protection. Larynx, voice box. Epiglottis flap that covers trachea during swallowing. Prevents food from entering airways. Critical for preventing choking. Vocal cords vibrate to produce sound. Controlled by muscles that adjust tension. Air passing through creates voice. Cartilage framework provides structure and protection. Thyroid cartilage forms Adam's apple. Cricoid cartilage forms base. Protective mechanisms. Cough reflex clears airways. Swallowing reflex protects against aspiration. The trachea and bronchial tree. The lower respiratory tract begins with the trachea and branches extensively within the lungs. Trachea, windpipe. Structure, 4-inch tube connecting larynx to bronchi. C-shaped cartilage rings keep airway open while allowing esophagus expansion. Ciliated epithelium moves mucus and trapped particles upward. Bronchial tree. Primary bronchi, right and left main airways entering each lung. Right bronchus is wider and more vertical, foreign objects more likely to enter. Secondary bronchi branch to each lobe of the lungs. Right lung has 3 lobes, left lung has 2 lobes. Tertiary bronchi supply individual lung segments. Bronchioles, smallest airways without cartilage. Smooth muscle can constrict or dilate. Terminal bronchioles lead to respiratory bronchioles. Structural changes. Cartilage decreases as airways get smaller. Smooth muscle increases in bronchioles. Epithelium changes from ciliated to simple cuboidal. The lungs and alveoli. The lungs contain the functional units where gas exchange occurs. Lung structure. Right lung, 3 lobes, upper, middle, lower. Left lung, 2 lobes, upper, lower. Smaller due to heart placement. Contains cardiac notch. Pleural membranes, double layers surrounding each lung. Visceral pleura covers lung surface. Parietal pleura lines chest cavity. Pleural fluid reduces friction during breathing. Alveoli, air sacs. Structure, microscopic balloon-like sacs. Number, approximately 300 million per lung. Function, site of gas exchange. Features: single layer of epithelial cells. Surrounded by dense capillary networks. Contains surfactant to prevent collapse. Surfactant. Phospholipid substance produced by type 2 alveolar cells. Reduces surface tension, prevents alveolar collapse. Deficiency causes respiratory distress syndrome. Mechanics of breathing, ventilation. Breathing involves active inspiration and passive expiration driven by pressure changes. Inspiration, inhalation. Active process requiring muscle contraction. Diaphragm contracts and moves downward, primary muscle. External intercostal muscles lift ribs upward and outward. Thoracic cavity expands, decreasing internal pressure. Atmospheric pressure pushes air into lungs. Accessory muscles can assist during forced inspiration. Expiration, exhalation. Passive process at rest, relying on elastic recoil. Diaphragm relaxes and moves upward. External intercostals relax, ribs move downward and inward. Thoracic cavity decreases, increasing internal pressure. Air is pushed out of lungs. Forced expiration uses internal intercostals and abdominal muscles. Pressure relationships. Air moves from high to low pressure. Boyle's law, pressure inversely related to volume. Breathing depends on pressure gradients. Gas exchange in the lungs. Alveolar gas exchange transfers oxygen to blood and carbon dioxide from blood. Pulmonary gas exchange occurs across the respiratory membrane. Respiratory membrane consists of alveolar epithelium, basement membranes, capillary endothelium. Diffusion drives gas movement down concentration gradients. Oxygen transfer. Oxygen concentration higher in alveolar air than in blood. Oxygen diffuses from alveoli into pulmonary capillaries. Binds to hemoglobin in red blood cells. Oxyhemoglobin carries oxygen to body tissues. Carbon dioxide removal. CO2 concentration higher in blood than in alveolar air. CO2 diffuses from pulmonary capillaries into alveoli. Eliminated from body during expiration. Factors affecting gas exchange. Surface area of respiratory membrane. thickness of respiratory membrane, solubility and molecular size of gases, pressure gradients across membrane, gas transport in blood. The cardiovascular system transports respiratory gases between lungs and tissues. Oxygen transport. 98% bound to hemoglobin in red blood cells. Each hemoglobin molecule carries up to 4 oxygen molecules. Forms oxyhemoglobin, bright red color. 2% dissolved in plasma. Small amount but important for diffusion. Hemoglobin saturation depends on oxygen partial pressure. Nearly 100% saturated in healthy lungs. Releases oxygen where partial pressure is low. Carbon dioxide transport. 70% as bicarbonate ions, HCO3, in plasma. CO2 combines with water to form carbonic acid. Carbonic acid dissociates into bicarbonate and hydrogen ions. Most important mechanism. 20% bound to hemoglobin as carbaminohemoglobin. Binds to different sites than oxygen. 10% dissolved in plasma. Directly dissolved CO2. Oxygen hemoglobin dissociation. S-shaped curve shows relationship between oxygen pressure and hemoglobin saturation. Shifts right, releases more oxygen when tissues need more oxygen. Affected by temperature, pH, and CO2 levels. Tissue gas exchange. Gas exchange at tissue level enables cellular respiration. Oxygen delivery to tissues. Oxygen partial pressure lower in tissue than in arterial blood. Oxygen dissociates from hemoglobin. Diffuses from capillaries into tissue cells. Used for cellular respiration to produce ATP. Carbon dioxide removal from tissues. Cellular metabolism produces CO2 as waste. CO2 diffuses from cells into capillaries. Transported to lungs via 3 mechanisms. Exhaled during expiration. Factors affecting tissue exchange. Blood flow to tissues. Oxygen demand of tissues. Distance for diffusion. Temperature and metabolic rate. Cellular respiration. Glucose plus oxygen, carbon dioxide plus water plus ADP. Provides energy for all cellular functions. Explains why we need continuous oxygen supply. Regulation of breathing. Breathing is controlled by neural mechanisms that respond to body needs. Respiratory control centers. Medulla oblongata primary respiratory center. Controls basic breathing rhythm. Inspiratory and expiratory neurons. Pons modifies breathing pattern. Pneumataxic center smooths breathing. Apneustic center promotes inspiration. Chemical control. Chemoreceptors detect chemical changes in blood. Central chemoreceptors, in medulla, respond to CO2 and pH changes. Primary drivers of breathing rate. Peripheral chemoreceptors, in carotid and aortic bodies, respond to oxygen, CO2, and pH. Become important when oxygen levels drop significantly. Normal breathing control. Rising CO2 increases breathing rate. Falling pH, more acidic, increases breathing. Severely low oxygen increases breathing. Voluntary control possible but limited. Breathing patterns. Normally automatic and rhythmic. Can be modified by emotions, exercise, speech. Protective reflexes like coughing override voluntary control. Asthma. Asthma is a chronic inflammatory condition affecting the airways. Pathophysiology. Airway inflammation causes swelling of bronchiolar walls. Bronchospasm, smooth muscle constriction narrows airways. Increased mucus production further blocks airflow. Airway hyperresponsiveness to various triggers. Symptoms. Wheezing, high-pitched sound during breathing. Shortness of breath, difficulty getting enough air. Chest tightness, feeling of pressure or constriction. Coughing often worse at night or early morning. Difficulty speaking during severe attacks. Common triggers: allergens, pollen, dust mites, pet dander, mold. Irritants: smoke, strong odors, pollution. Exercise, especially in cold, dry air. Respiratory infections: colds, flu. Weather changes: cold air, humidity changes. Emotions: stress, strong emotions. Treatment: quick relief medications, bronchodilators, for acute symptoms. Long-term control medications, anti-inflammatories, for prevention. Avoiding triggers when possible. Action plan for managing symptoms and emergencies. Chronic obstructive pulmonary disease, COPD. COPD is a progressive disease that makes breathing increasingly difficult. Two main components. 1. Emphysema. Alveolar destruction: air sacs lose elasticity and rupture. Reduced surface area for gas exchange. Air trapping: difficulty exhaling completely. Barrel chest appearance in advanced cases. 2. Chronic bronchitis. Chronic inflammation of bronchi and bronchioles. Excessive mucus production blocks airways. Persistent cough with sputum production. Frequent respiratory infections. Primary cause: smoking, responsible for 85 to 90% of cases. Long-term exposure to lung irritants. Alpha-1 antitrypsin deficiency, rare genetic cause. Progressive symptoms: early, mild shortness of breath during exertion. Moderate, increased breathlessness, reduced exercise tolerance. Severe, breathless during minimal activity, oxygen dependence. Treatment: smoking cessation, most important intervention. Bronchodilators, open airways. Oxygen therapy for advanced disease. Pulmonary rehabilitation, exercise and education programs. Vaccinations prevent respiratory infections. Pneumonia and lung cancer. These conditions represent serious threats to respiratory health. Pneumonia. Definition: infection and inflammation of alveoli. Causes: bacterial, most common, often Streptococcus pneumoniae. Viral influenza, COVID-19, others. Fungal, more common in immunocompromised patients. Symptoms: cough with phlegm production. Fever and chills. Shortness of breath. Chest pain during breathing. Fatigue and confusion, especially in elderly. Treatment: antibiotics for bacterial pneumonia. Supportive care for viral pneumonia. Rest, fluids, and fever management. Lung cancer. Leading cause of cancer deaths worldwide. Primary risk factor: smoking, 85% of cases. Other risk factors: second-hand smoke exposure. Radon gas exposure. Asbestos and other carcinogens. Family history. Symptoms often appear late. Persistent cough that changes. Coughing up blood. Chest pain. Unexplained weight loss. Shortness of breath. Treatment: surgery, chemotherapy, radiation therapy. Targeted therapy and immunotherapy. Prognosis better with early detection. Key takeaways. Let's review the essential concepts from this module. The respiratory system provides oxygen for cellular metabolism and removes carbon dioxide waste. Upper respiratory tract, nose, pharynx, larynx, conditions air for the lower tract. Lower respiratory tract, trachea, bronchi, alveoli, conducts air and enables gas exchange. Breathing mechanics involve diaphragm and intercostal muscles creating pressure changes. Gas exchange occurs at alveoli through diffusion across the respiratory membrane. Gas transport relies on hemoglobin for oxygen and multiple mechanisms for CO2. Breathing regulation responds primarily to CO2 levels through neural control centers. Common respiratory disorders include asthma, airway inflammation and constriction, COPD, progressive airway obstruction, pneumonia, infection and inflammation, lung cancer, uncontrolled cell growth. Prevention focuses on avoiding smoking, pollutants, and respiratory infections. Thank you for watching HESI A2 Anatomy and Physiology series. You now understand how the respiratory system works in perfect coordination with the cardiovascular system to deliver oxygen to every cell while removing carbon dioxide waste. Remember that the respiratory system you've learned about today provides the oxygen that makes digestion meaningful. Without oxygen, cells cannot use the nutrients from food. Each system supports the others in maintaining life. Keep building these connections as you continue your HESI A2 preparation. See you in the next video.